Hey guys, thank you so much for joining us for the latest Women in Surgery faculty highlight video. I'm Meta Smith. I'm a third-year medical student at UAB and I am interested in ENT. And today I'm speaking with Dr. Jessica Grayson, who is an ENT at UAB. She's also an assistant professor and director of ENT research. So Dr. Grayson, thank you so much for joining us, and I'm going to let you introduce yourself.
Jessica Grayson. I'm born and raised in Alabama. I'm an assistant professor in the Department of Otolaryngology, or ENT, much easier way to say that. I did my UAB. I stayed on at UAB for residency, and ENT is a 5-year surgical residency. And then after that, I went to fellowship in Sydney, Australia for a year to do rhinology and anterior skull-base surgery, so endoscopic skull-base surgery. And then came back on faculty at the completion of my fellowship year. And I've been back just over 2 years on faculty. And I took over as the director of clinical research. It's a role that's been present for many, many years, but we've kind of retooled it a little bit. And so have really been working hard to make some changes from a research standpoint within our department. I have an older sister. And my parents still live in Alabama. I've been married for 7 years, and I have 2 children, 2 little boys, Jet, who's 4, and Jones, who's 7 months old.
Awesome. That sounds like a pretty interesting path, especially the little journey to Australia part.
Yeah, it was fun.
You were talking a little bit, actually, you went in a lot to your journey towards ENT, but did you know from the get-go that you wanted to do ENT, or tell us a little bit about how you got to that decision?
The general surgery rotation, which I loved all of those, but I talked to a mentor who said, hey, go check out these other subspecialties. And I spent 2 weeks, I did a 2-week elective on ENT, and I immediately felt at home. And it was a late decision for me. It was actually really late in 3rd year. And so it became a big scramble to try to get everything together for interviews and applications. But the department was super supportive and helped me out and get things all situated. And then I obviously ended up staying at UAB, which was a blessing in very, whole lot of ways. So.
And you're from Alabama, is that correct?
Yeah, I grew up just north of Tuscaloosa, a small town called Fayette. It's got about 4,000 or 5,000 people. It's one of those places where everybody knows everybody. And so it's really nice to be close to home, close enough to home if my parents need me or if I need them. They're not too far away. And having UAB be the biggest academic center, kind of East Mississippi, West Georgia, and Alabama, it's nice because a lot of people that I know or grew up around end up coming up here for their care for a lot of other things. And it gives me an opportunity to help guide them or spend time with them when they're here. It's not always an ENT issue, but trying to help them figure out, navigate the system sometimes is really.
I bet that was helpful too, to have a support system pretty close by as you were, doing things in residency. But we're actually getting to one of my other questions, was about, have you had any challenges as a woman in a surgical field, and how did you overcome those?
Yeah, so I think the field is so much better now than it was 50 years ago. ENT recently released an article, and we compared the experience of the first female who ever trained in our program to mine. And it was amazing to think, like, she was the first girl who finished medical school to do a surgical residency at UAB, and what that looked like for her, and how people really counted her out because she was female. They thought, oh, well, she'll get married and she's not going to want to work, or she'll have children and not want to work, as if those things are mutually exclusive. And I have to say that while we still have a lot of work to do in a lot of areas, things like maternity leave and paternity leave policies and supporting female physicians and promoting female physicians, all in all, when I compare to the experience that she had, I feel like I would be remiss not to say that things are so much better than they used to be. But certainly there have been comments and things that have come up. It's more long, probably less because I'm a female surgeon and more because I'm a female. Sexual harassment is still alive and well in this world, unfortunately. And a lot of times when you're in training, you don't really know what the safe way is to manage something like that. Not just that you think that someone's going to retaliate against you, but you don't want anything to be cast you in the wrong light, and you don't really want to have to go defending yourself. You just want to be able to stand up and be assertive, and people to believe what's happening, and be able to move forward. And so I certainly had issues with that, and I was very lucky that when I made a comment or stood up for myself in those situations, that I had support from my department and the people who were around me. Most of the time, you'd hardly know the difference between the female and male faculty from the way that we're treated. I've had two children, one in training, one in as a faculty member, and both times, no one ever said, "Oh, you can't do that," or "We don't want you to do that," or "No, you can't take maternity leave," or "Do what you need to do." They were all really supportive, and honestly kind of invested, especially in residency. Like, our chairman sent me a present for my son, and it was like all his favorite books that he had read to his children when they were young. And
Aw.
really wonderful, because we were in two very different generations. And he said, "Hey, look, I recognize you're doing these two things, and that it's a really big deal. And it's a really big deal to be present for both. And so we support you and we love you." And I mean, it's been that way the whole time that I've been here. And I feel lucky to been able to do that. But that doesn't mean that there weren't times where that was hard. I mean, walking around the hospital, being on call at 37, 38 weeks pregnant, it's hard. But I imagine that doing any job at that point is hard. I have just never been doing any other job but this one. Um, and so I think the big things to take away from that is to have good promoters and good supporters. I think women still very much need that in this field. And there's a lot of other professional fields where this is true, but we need more than just someone to say, "Hey, I'm on your team." You need someone to say, "Hey, have you thought of Jessica? She would be great for this." Somebody who can promote you. And I've been very lucky to have that. And so, as much as I think there are things to be done and work that can still be done, I feel very lucky for the experience that I have had. And I recognize that it's not the same as everyone else who trained in different places, or maybe just in different specialties for that matter. I've been lucky to have a very supportive group.
I've heard that before. I think from another female surgeon about the promotion of students or of residents or of faculty, and that it must be a really big thing as you move forward in the medical journey. I can't say that I've had a lot of experience with it, but I've heard it from a lot of people, getting advice from them.
Yeah, I think it's been a big move in a lot of the professional societies, because, I mean, women have been showing up and showing out for years, and their male counterparts have recognized that, particularly the ones that work with them every day. The issue is that no one, at least for, until now, no one stepped back and said, "Well, why aren't they rising to the next level?" It's not because they're not good enough. It's not because they're not dedicated enough. It's probably because somebody who had the power never thought, "Oh, I need to say something." And I think that that is something that people are really moving, much, much more forward to. They're more aware of it. They know they can't just be saying, "Oh, well, look, she's great." They have to say, "Oh, look, she's great. I think she'd be great for this." And I mean, I've been so lucky. I have a chairman who has done that. And I have a senior partner in my subspecialty who has done that without a doubt, has always offered up opportunities for me, and gone out of his way to say, "Hey, look, she'd be really great for this." And so I wouldn't be doing what I'm doing without that support.
That's so cool. That's encouraging. Um, all right, so our next question is, and this, I feel like all these questions are very like intertwined, but what advice would you give female medical students when exploring surgical specialties?
So what I would say, and this is true kind of regardless of what you want to do, you never want to pick a specialty that you're not super sold on, because all aspects of medicine will require a lot from you. And sometimes it will feel like it's too much. And at the end of the day, if you're happy with the choice you made, then it'll be okay if that day expected a lot from you. I think that holds true even within surgical subspecialties, general surgery, orthopedic surgery, plastics, ENT, opto, whatever your choice is. The other thing I would consider is your priorities. Now, you can have everything at some point, right? So the I can have it all the time is a fallacy. You cannot. It's not possible. To think that you can is actually to set you up for failure. But if you think about what your priorities are, and they will help guide you to make decisions. So I'm a very family oriented person, like extended family oriented person. And when I started residency, my grandparents were still living. I loved UAB. I loved the camaraderie. I loved the faculty. I loved the educational opportunities, the operative experience, all of it. But one of the big things that drove me to want to stay home was to be close to family. It turned out that as I got married and had children while in training, it was kind of fortuitous that I was nearby family. And the same things have rung true. I left. I went about as far away as you can get before you come back to the United States. And I am still close to home. And part of that is to make sure, for me, I know that I need some help with my family. And I would love for it to be my parents or my in-laws. And so that's been really great. I've got friends who do what I do and live far away from their families and have assistance and help, But if you love the things that you're doing, all of those little sacrifices that you'll make, and you're going to make them regardless of what you're doing, will feel worth it. If you think that there is something else that could make you happy, like I could do this or this, you need to explore both. Recognize that as time goes on, your priorities will change. You may start out saying, I want to do the biggest, hardest cases of all time. I want to be one of only 5 people in the country that can do that. And then your priorities may change. You may decide that you would like to work in private practice and you would instead like to be able to volunteer, or you may, want to have different control over your work schedule for family reasons or personal reasons, hobbies, whatever. And so give yourself some grace in that process. Make a decision about what you like. Also know that what you like at 25 and 26 and what's important to you will change at 30, and it might change at 35. And I would say that there's absolutely nothing that you cannot do. Unfortunately, I heard someone mention they had chosen a very difficult surgical subspecialty. And they said, well, when I decided to do that, I knew that I would no longer, having kids was never going to be an option. And I was like, no. That doesn't work like that. If that's what you want, that's fine. But you don't have to let that be the truth just because there's something that you want to do. Like, you can be the only person in the world who can do something and you can still have children if that's what you want.
Right. Well, thank you for that. That's a lot of really good advice. I'm taking everything that you're saying in right now because I feel like these questions are specifically for me, but there's a lot of us that want to know this stuff. All right. So I have another question. Tell us about a hobby that you enjoy outside of work.
So I have a couple, actually. My husband and I are very out people. And so we actually, when we were dating, used to just go for long runs together. That was our thing. So I still like running. We don't do it together as much anymore because someone's got to stay with the 2 munchkins when we go out for a run. But I do love to do that. And when grandparents are in town, being able to go out, the 2 of us, on a long run is really nice. I enjoy snow skiing as well. Now, I haven't been able to do that as much because of COVID lately. The last couple of years, I haven't been able to travel. But that's kind of my favorite, like, not in Alabama thing to do. And I do enjoy travel, but it doesn't really matter where it is. I just like to be outside with nature. You could just be driving up to North Alabama and do a little hiking. Coffee and a sunrise with a beautiful view over some trees is like my favorite place to be.
That sounds amazing. Do you feel like you've gotten to manipulate your schedule to be able to facilitate those hobbies pretty well?
Yeah, you not so much in training. You get a certain set amount of time of vacation and you have to work out those things, but I still did them then. I mean, we made time for it then. I had to make that a priority when I was on vacation. Now, absolutely. I mean, this is interesting thing that happens when you go from being a resident to a faculty member or, attending in private practice. You don't have to ask permission to take vacation anymore. Check somebody else. Well, it's really not that you have to get permission to double checking everybody else's schedule. I can just say, I'm going to be off these days. And it works and everybody's really supportive, which is nice. I think I went around the first year like asking my partner, like, hey, is it a vacation? And he was like, yeah, it's you want to do, it's fine. And I just didn't think about the fact that I don't have to ask anymore. I can just take it.
It's a whole
And so,
nother level.
yeah. Yeah. I definitely made time for those hobbies because I think this job takes a lot of you, a lot of pieces of you. You're with people in very vulnerable states. You're dealing with them sometimes in some of the scariest aspects of their lives. And that's a lot to carry along with people. And maybe that's something women do more often than men. Maybe we carry that with us a little more. And so I have to have a place where I can decompress because when I get home, there's three guys waiting on me, two little bitty ones who really don't understand. And they need for me to be able to switch gears with relative ease. And I think the only way that I can do that well is having my own outlet where I can work through some of the tough things that we do at work. And, there's battles you don't win, and that's really hard. And so being able to have a place that you can go to, your quiet place, whatever it is, where you can process, that's really nice. And I've definitely made a point to do those things because I think it's very important for my own success, not just at work, but also at home.
Right. Well, that is all of our questions that we have for you. And thank you so much, Dr. Grayson, for speaking with us today and answering all these questions and even my impromptu questions that I came up with. And thank everyone for watching this video for Women in Surgery faculty highlights. And again, thank you so much, Dr. Jessica Grayson. You are inspiring.